individuals who will present with dry, irritated eye complaints that may not necessarily have dry eye. These individuals may present with uncomfortable eyes along with the classic dry eye signs including positive inflammatory test, reduced tear film breakup time, corneal staining, and even conjunctival staining. They may even present with decreased meibomian gland structure and function. Patients may also present with an acute conjunctivitis. It may respond well to antibiotic steroid combination drops, but oftentimes several weeks to months after the initial presentation, these individuals may come back to the office with a return of symptoms. Floppy eyelid syndrome is a condition that's characterized by a rubbery, easily averted upper eyelid that's often accompanied with variable papillary response. The first indication of this can be seen by pulling the lower eyelid down. This gives the clinician an indication of the elasticity of the lower eyelid, or lack thereof, which is typically seen in this condition. Eversion of the upper eyelid is truly how to identify individuals with floppy eyelid syndrome. The eyelids avert without significant effort, which is believed to be caused because decreased levels of tarsal elastin. This causes the lid to lack appropriate elasticity and will oftentimes lead to the eyelid spontaneously opening in the evening during sleep. This mechanical exposure and inadvertent rubbing of the eye will often lead to the signs and symptoms seen in these individuals. The key to identifying floppy eyelid syndrome is to make sure that everting a patient's upper eyelid is an important step in your anterior segment examination. These patients often need more viscous lubricants in the evening and either taping eyelids shut in the evening or wearing eye shields to protect the eyes. We found punctal occlusion in these individuals works well to promote sufficient tear volumes on the eyes. Some individuals may even require surgical intervention to tighten the upper lid. Because floppy eyelid syndrome is associated with obstructive sleep apnea, it's important to identify these individuals and educate them on the association and explore appropriate workups for individuals with symptoms that would warrant it. Remember that a symptom of dry, irritated eyes should be thoroughly investigated to determine its true cause. Floppy eyelid syndrome can be identified by making certain to avert the upper lid during the examination of symptomatic patients. Identifying these individuals and appropriately treating them is critical. And additionally, make sure to educate them about the association with obstructive sleep apnea. Keeping these things in mind will help us appropriately care for our patients, which is ultimately why we do what we do. We hope that this has been clinically insightful.